Welcome to Connecting Communities. I'm your host, Nancy Bacci. With me today is Doug Kress, the new director of the Department of Health and Human Services for the City of Somerville. Thank you for coming on today, Doug.
Well, thank you for having me, Nancy.
As we know, the Department of Health and Human Services encompasses so many different areas that we really want to make certain the community is aware of all the great offerings that exist. But before we dive into that, because that could be a whole show in and of itself, we do want to chat a little bit more about you. We want the community to get to know you. So how about a little bit about your background and how you landed in our fair city?
Oh, well, first of all, thank you for having me today. It's a great opportunity to let people meet me and learn a little bit about me. Some people actually may recognize me. This is not my first go-around here in Somerville itself. A couple of years ago, I was actually here as part of a fellowship program that I was awarded back in Minneapolis, which is what I would call my hometown. So let me tell you a little bit about myself. I actually do have a background in public health, but I have a very broad background, and it's kind of an exciting one, I think, for myself. That
Share
really
with the viewers.
Great, that will really help help me in this position that really makes me a unique person for this position as well, because I have a very broad background within public policy itself and public administration.
Excellent.
And community work itself. So I'm going to go back a little bit of time. First of all, I am from Minneapolis, Minnesota. So I am joining you. And I just want everybody to know that you actually had more snow here in the Boston area in Somerville than we did in Minnesota this year.
That was quite ironical this year. When we knew you were coming on board, it was like, great. And then speaking with you, and it was like, yeah, you know, barely a coating. And it was like, really, I can't see out my first floor window. So it's quite a switch. And to come here now with the signs of spring coming, though, is definitely a nice change.
It is a nice change. And I'm glad I could bring some of the warm weather with me, just so you know.
We appreciate that as well.
Well, they've already had some 70-degree weather up in Minneapolis, so I was able to bring some of that warm weather, although you may not know it today since it's a little cloudy and chilly out there today.
And a chance of sleet.
Well, you brought that along. I think that wasn't me.
But onward. So tell us a little bit more about your unique background.
So a little bit more about me in Minneapolis and how I got to Somerville itself. My background, I actually started, and I have a degree in public health and public administration, but my concentration was really about community health and working with patients and working with the community itself, doing a lot of community engagement. I had the great opportunity of being part of Minneapolis for many, many years. I started out as an intern with the city itself, working on a variety of projects that were really bringing in community health into the department itself, doing outreach, working with a variety of communities that were usually underrepresented. And where I found my actual original niche was working with young people in a variety of capacities. And obviously with young people, there are many issues that continue to happen over and over again. It's just a cyclical type of activity that we see. So I started out really working on HIV and sexuality issues and prevention areas of that. Giving up my age a little bit, it was when the epidemic was just beginning, or pandemic was actually just beginning in our country itself and showing up in Minnesota. So as you can imagine, that was late 80s, early 90s. And through that, I actually became one of the experts throughout the country, really looking at youth and HIV, doing the prevention areas. I got to do a lot of work within the legislature itself, and also working with the school system, and really starting to build those bonds between schools and communities on how to do that educational component, not relying so heavily on our school system to do these projects and do these activities that are outside the everyday learning activities that are traditional in the schools. So we really did build a new style of thinking in Minneapolis about how we can work with schools and bring communities into the schools to do some of that education. So it was a great opportunity. From there, it kind of grew into a lot of violence prevention, working in our school-based clinics, doing a variety of programs for young people. I had a great time doing a lot of that. However, as with most municipals, we had to lose some funding, and or we had to cut back in our funding, and the whole department ended up getting eliminated. However, I was lucky enough to actually get a promotion, and then I started to work on more administrative work in the health department itself for the city of Minneapolis. From there, I ended up going to work for a new type of a collaboration in Minneapolis, where we brought together different entities of government to really look at policies for young people. And it was called the Minneapolis Youth Coordinating Board. And I was one of the directors there working on a specific program that brought services into the schools. And it was social service agencies as well as health agencies into the schools to provide the services in centers themselves within our school system. And in that, it was building not just a service that they were bringing in, but they were bringing additional dollars so that we could do a real network of services for the students, allowing them to get the services in the school. Instead of taking students out of school to go get the service, we brought the services to the students. Looking at attendance is one of our primary issues that we wanted to improve, as well as knowing that if the attendance was going to be improving, did that mean their academics actually improved as well? So we really looked at the data in that and found that that was very successful, and it continued on after I had left that organization.
That seems like that would be really fascinating. So much of what you've already said is triggering a million other questions in me and other things. So one point that I really like you've emphasized is the collaborative effort. As you know, Somerville is really all about community engagement. Mayor Curtatone is very adamant in his charge to all of us that we are hearing from our constituents and understanding the needs and concerns of the community and being responsive and reactive to those, and in many instances being proactive in terms of addressing issues that are happening in our community. So much of what you said is really, again, I think it does make you kind of a great fit for this position, because we rely so heavily on our interactions with the communities and the collaborations with the school department and all of the other city entities to really strengthen the work that we're all doing.
Yes, and that's one of the reasons why I decided to take this position, actually, is because there is the leadership coming from Mayor Curtatone that really does look at how do we look at our community, how do we engage our community, and how do we make them part of what we do to help build that web, to help build that support system for our kids and our families, for people who live, work, play in this community itself. We want to be able to raise a community. It's not just about raising children, but it's raising a community and raising awareness and really building that network and that web of services that we can then have for our community to make it the greatest place to live. An even better place to live, because it is a great place to live already, which is what I'm finding out.
I agree with you that one. As someone who lives and works here, it's a great place to be all time. So once you had done that part of your career, what was your next transition?
So after that, I worked in a variety of places within our youth coordinating board doing a variety of programs, including early childhood education. While I was with them, the director of that area actually left, so they needed somebody to fill in, and of course they just expanded my job, as most entities end up doing. And I was running both of those organizations at the same time, so I really got to expand my knowledge base to working with early childhood education, looking at prenatal care for children and their families to make sure that actually kids are ready to start school. One of the research projects that we had worked on and that we were collecting data for was really understanding how were kids coming into our school system? What were the gaps in services that they needed to really be healthy? And we ended up going all the way back to prenatal care to make sure that the mother is healthy and she delivers a healthy child to start with. And the first breath is actually a healthy breath, and that's really what we looked at within that.
See, that's amazing too, and that actually ties in nicely with the work of our Summer Promise department, which is, again, providing wraparound services in utero through college preparation or entry into the workforce, really understanding all the factors that go into creating a healthy individual living in a healthy community. So, you know, if you're going to school and you're getting your breakfast and lunch at school, that's great, but what happens to you during school vacation? What happens on the weekends? What happens if you need tutoring in a particular area that isn't immediately available? What happens if your parents are working multiple positions and you're taking on a more parentified role within your household? How are all of those needs being addressed? And as I said, our Summer Promise division has been working for years on a true collaborative effort, bringing together all of those service providers, identifying the gaps that young people and their families are facing, and really working towards a resolution to, again, get everyone in the city best prepared to live the most productive life.
Yeah, and you're only touching the surface for a lot of those things. You know, that's just the tip of the iceberg that's coming out of the water for a lot of those things. There's so many other issues that we, and things that people have to think about whenever we're talking about having a healthy person and growing up healthy and having a healthy community. And it is an encompassing thing, and it's very true. It does take a whole village to raise a child, and it takes a whole village to keep a child and an adult engaged within that community itself, because we know that an engaged person is really one who's going to be productive and help others as well, and that's what's really nice about some of those things. So let me get back to some of the other things I've done. After I worked for the Youth Coordinating Board for a while, I ended up leaving there, and I ran a neighborhood organization, a community-based organization. I took only about 8 months that I was there, but it was interesting. It really got me into some other types of things, really looking at communities and putting a real focus on a community effort. And it got me a little more engaged with development work. And in that development work, I'm talking about construction development, not trying to fundraise, although that's always a part of anything that we do. From there, I actually got a call from the city council. And in Minneapolis, we have a strong council week mayor system, so you really are having 13 bosses when you work for the city. And we had a 13 council member that we worked with. I got a call from the council, and I was called by the representative who did most of downtown, and it was really an interesting ward because she had some of the richest communities and members as well as some of the poorest community members, and focused in on downtown. And I was asked if I would join them and become their senior policy aide for the city itself. So that I took some time, and I wasn't sure I was going to do it. And then I ended up saying, yeah, this is something that would be interesting. It really kind of kept me engaged within municipal government, which is what I love to work on and be with, because I think all politics are local, and really making a change is going to happen locally, and it was able to do that. So I worked on a variety of issues with them, and that's really where I dug my teeth into a variety of projects, anything from looking at how do we do construction, how do we pave roads, and something that we can always use here is how do we clear those roads in the wintertime. And in Minnesota, we do get some snow and ice, and it stays around for a long period of time. Up to working with the Health and Human Services areas on engagement, grant working, and then we did everything in between, police, fire. So I had to really have a broad knowledge of what was included in a municipal government itself. I was there for over 10 years working with them, and did a variety of projects, wrote a lot of policy and ordinances, and helped shepherd those through the system and the process itself. Great opportunity to do that.
Sounds fascinating.
It truly was, and that can be a whole 2 shows if you'd like on that one. But after a while, I was then nominated for a fellowship. And this is through a foundation in Minnesota called the Bush Foundation, which was started by Edith and Archie Bush. And they were part of 3M money. And what happened is they offer this mid-career fellowship program, and you get to apply for these grant dollars to take you out of your everyday milieu and put you into a different location, leaving your position and trying something different, learning how other people do what you do, so that when you come back, you're able to do it a little bit differently, or you bring a different light to it. It was a great opportunity for me to do that. So what I ended up doing with my fellowship is coming out to the East Coast, and actually had a chance to go to Tufts and Harvard and do coursework, getting another degree, but also work with 3 different communities. And one of those communities was Somerville. So I was here working out of the mayor's office, helping on a variety of projects. And they could use my expertise from my past and do anything give me any project that they wanted to. So I got to work on quite a few projects, including the urban ag policies, looking about ADA and ADA compliance, and I was lucky enough to be one of the people who helped hire Betsy Allen, our ADA coordinator here in the city of Somerville, who is a wonderful person.
Yes, she's great.
And does a great job with us. And then when my fellowship actually ended, the mayor asked if I would stay on and do a couple other projects. So I went over to ISD, and I helped them out for a little while as the interim director, and then when we got Gorin in, I ended up going down to the police department, helping them for a little bit. And then Minneapolis called me back and said, Doug, we want to appoint you to a new position. Would you come back? And I ended up going back to Minneapolis, where I was the Director of Development Services. In that position, I was in charge of planning, zoning, and code construction, so all of the inspectors. And it was a great job, and I absolutely loved it. We got to do a lot of different things. I helped get the new stadium being built in Minneapolis for the Vikings. I got to be part of some of that. We had a huge new development, similar to what we have over at Assembly Square, where it was a surface parking lot, and now it's slowly developing. So it's great to be part of some of those things. One of the things that I love about being in a municipal government is that I can go around and I can say, wow, I got to be part of something that was amazing. And it's a great opportunity. So then back in this past fall, I got a call. Actually, I was out visiting some friends here in Somerville, ran into a couple of staff, and they said, would you ever be interested in something over here? And I wasn't sure about it, but we talked about it. And after our discussions, I knew that this is where I wanted to be again. I really enjoyed my time out here in Somerville, and I'm thrilled to be back and working with you and all the other staff at HHS.
Well, it's great to have you back. And again, the energy brought to the department is really great. And I'm going to list everything now that falls under Health and Human Services for people to be aware of and realize there is so much that's encompassed within this department. Like I said, we really can only kind of skim on all of them because there are so many different departments. But again, all working together to build the healthy city. So I'm Director of Human Services, and under me falls the Office of Commissions and the ADA department. We have Shape Up Somerville, which initially was brought on board addressing childhood obesity and has expanded so far beyond that, really promoting healthy living within the city, Shape Up approved items at local restaurants so people are able to patronize their local businesses, support the local economy, and still able to make healthy dining options when you're out. We have the Office of Prevention, which oversees Somerville Cares About Prevention, which, as we know, works on underage substance use, drug prevention. It has the tobacco initiative under that as well. We have public health nursing, school nursing. It goes on, and I want to peek to make sure I didn't miss any of them. We have the Trauma Response Network, which is an amazing asset in the city. And I do want to take a moment to give a little more detail about that because I think it's such a valuable service that some people might not be aware of. So the Trauma Response Network exists. It is staffed by a Health and Human Services Department staff person, as well as a literally army of volunteers who have all received training in the area. They are clinicians, lay people, clergy members, all of these things who have been trained to come together to provide supports. So when an awful event happens, and no matter how much we hope against it, these things do happen, we're able to provide supports to the community. So whether it's being activated by the school department in the case of an unexpected passing of a student, or a community member reaching out saying this is an unexpected death, we need support. So we're able to go in and provide coping groups to these people to give them some tools and techniques to try to manage some of the feelings. And again, we are not providing counseling sessions, we are providing tools for people to access. And to realize you can be a supportive presence for someone. You know, in the past we have partnered with local grassroots agencies to host a vigil for to raise awareness of the lives lost to overdose. And as we know, this is the overdoses that we're hearing about in our community. This is not a Somerville problem or a Massachusetts problem. This is a national problem at this point. We're hearing global instances every day in areas where you don't expect to hear of these sorts of things. And I think Mayor Curtatone has always been very proactive in addressing these issues and really sending the supports necessary to work with the community to address these things. We have coming up on April
24th?
Nope. Well, we can talk. April 24th is Take Back Day. So that is Saturday, April 25th. Actually, I apologize. And that is Take Back Day. So in our public safety building located at 220 Washington Street, we have kiosks where people are able to dispose of unwanted medication. And as we know through survey results, which we'll chat about the YRBS in a moment, and hearing anecdotal stories from community members, there needs to be a safe place to make that happen. So think of ourselves. I mean, you have a tooth removed and maybe you get a prescription and you take a few. And if, like most of us, they sit in your medicine cabinet because you're not really, you've used them when you needed it and it's just kind of tucked away. But then we're finding out that a lot of young people, their first level of access to prescription medications that are prescribed to others are through medicine cabinets, in their own home, at a friend's home. So the city has the kiosks located down at the public safety building. And again, it's an area you take the label off, put them in. No one's checking what you're dropping off, but it's a safe way to get them out of the home, limit access to young people. And really, we don't need these things hanging around.
I agree. And one of the things that we are actually printing up right now, another issue of it or another copy of it, When you do get a prescription like that from your pharmacy here in Somerville, you're also going to be given a little piece of paper as a reminder about that. I don't think that, we can't always remember that every single time. So all of these little reminders are also just little hints for all of us to keep in mind whenever we look at this. And I agree, it's a challenging issue that we're facing right now. And losing a young person, any person, to an overdose or any of those types of challenges that we face in our community is never easy. You're correct in that the trauma response team is a great group that can actually be almost like the first group that can kind of help out to really do some triage, to help figure things out, but then bring community together to help solve that. Again, that's building that web and building that community itself, which is so critical to make sure that we have a healthy community. And Mayor Cotitoni is really doing a great job of spearheading a lot of that and being a leader in the Commonwealth as well as across the country, whether that's the Shape Up Somerville group, the Shape Up Somerville that was started, in 2002, I believe, really getting some recognition. We can continue to look at what else can we do to really put the patient in the center and the person in the center, and what do we need to build around that?
And I think, as I said earlier, that really is the mayor's expectation of his staff, is that we are consistently working to better the community. There's doing your everyday work and doing your job, but the expectation is that we as staff are trying to measure the ripple effect in the community and really identifying particular areas that we need to work on addressing. I mentioned a moment ago, we know some information through survey results. So each year we conduct the Youth Risk Behavior Survey. So it happens on even years at the high school and odd years in the 6th, 7th, and 8th grade. And the one thing that is really great with this, and I know you're going to be helping to administer for the first time, so it's a fun time.
Next week, I believe, is when we're
going
back
back
into the schools.
It is happening on the 14th, right? So we go in, the surveys are conducted, and these surveys ask questions that really span what we need to know in the answers from our young people. So it focuses on risk factors, protective factors, and the data is analyzed by a consultant, and then we're able to get back the results and track trend data, which really is the most important when you're looking at terms of issues coming up and where are we seeing the highest risk happening. We are able to track these things because they're asked the same questions each time. So you're seeing young people are using alcohol less than they have in the past. You're seeing young people are smoking cigarettes less than they have in the past. But you're also seeing young people are identifying less percentages of a trusted adult they have at home than we've seen in the past. So that data is interesting, and it really helps to inform programming, conversations, all of those things. But, seeing a copy of the survey, it amazes me how far it delves. So you're asking people about current use and current uses within the past 30 days. So maybe you're seeing young people identify that they've been using alcohol at that point, but somewhere else on the survey they're going to indicate parents have gotten divorced, there's been a death in their family, something. So you're able to determine almost, is it an isolated incident? Is it something that we're seeing when they then transition into a new grade? We know the transition from 8th grade to high school is a difficult time for our young people. So having this information, and again, we love data, so having the ability to track that really helps to identify where do we need to put supports in, what sort of programming addresses those issues. I know next year on the high school level for the first time, we're going to include a question asking about food access at home, because as we know, this is becoming an increasing problem within our community. We expected it to abate somewhat after there was a slight economic improvement for a lot of people, but we're seeing families that are accessing food pantries more frequently, utilizing the free breakfast and lunch programs that exist not only within the school department, but in the summertime are offered at parks and playgrounds. So we want to try to get a little bit more information about this and identify ways we can work to support this issue.
I agree, and I think some of the things that, what we're talking about here today are really kind of a great entry into understanding where we're at as a community and giving us some data within that and looking at programming. And I'm glad that you have a good understanding of what a lot of these are, because many of these are going to fall under you as the human services staff and the director there. So you're going to have to help us look at what are those trends that we have? Where are our gaps? What do we need to kind of look at to really kind of move forward to build those services and to build those supportive services out there? It doesn't necessarily mean that we have to do do that as a community or as a city
Right.
itself. There are many partners that are out there, and that's why I really like looking at what are our partnerships that we have available out there, and that where are those gaps then, and how can we help maybe fill those? It may only be temporarily a fill that we need to have, but it does help support the kids and the families. I think what's important about this data, though, also is that this is a snapshot in time for an individual, and it's their attitude of where they're at that particular day as
Right.
well. That is something we always have to keep in mind when we look at this data, and as we look at our trends and how they're answering those. One of the nice things when you look at this particular report and the data that will be given to us are that there are ways to look at that data and the questions in which they give us that will kind of counteract one another to ensure that we get some consistent data within that. And that's one of the great things about how we do this particular survey and the consistency of giving the survey as well. We can look at those trends. We can see where we've seen the dial move and where we haven't seen it move, whether that's a positive or negative direction, so that we can help look at that and program into the future, trying to be on the cutting edge, being innovative in our programming, which is exactly what Mayor Curtatone wants to try and do for us in this community itself, is really moving us forward to be a leader. And I think we can do that here in the city of Somerville, whether that's through the programming that you'll be looking at as we move forward, or whether those are other programs that are existing. Finding those partnerships, building those things that we need to build, and supporting those things that are existing to make sure that people are connected to those services and entities is really a critical part of what we and role that we can play here in the city.
I do agree. I think the responsiveness of the community's needs can't be emphasized enough. You know, as you said, we as a city are happy to take the lead, but also realizing that we do need to depend on our community partners, other entities, other departments as well. None of us can do the work alone. And, you know, there are already so many great people working on so many of these issues that, you know, we need to manage our time wisely and use resources in the smartest way possible. So when we have people who are working on a particular issue that we identify as an area of interest, it's so much easier when we already have the relationship and the rapport built to strengthen that partnership and support the work that they're doing while addressing it overall for the entire community. One thing I did want to mention, again, as kind of responsiveness to the community, is there is a panel discussion coming up on April 15th that is going to cover issues such as the Good Samaritan Law. As you now know, all of our police and fire carry Narcan now and have been trained in that. And that was a direct response to what we were hearing. We were having overdoses happening within the city. We're working on this with various strategies, but really the community wants information. And the easiest way we think to provide that is to offer it up in such a way that it's easy for them to access. You know, some people, for a lot of reasons, whether it's language concerns or the idea of the quote-unquote government, may not see the city as their default to go to for information. So when we partner with local agencies such as Somerville Overcoming Addiction, who has a large network of people working on this topic, and you're able to bring that, they can disseminate information to their populations. And it really makes, I think, for a healthier partnership overall. And I know Chief Allen will be participating in the panel as well, and he has been very proactive in this area. And again, it's a nice way for people to kind of have easier access to, you know, the police chief. How many people can say, you know, I had a question, and it's the same with Mayor Curtatone. And the mayor attends all of these local events, and people are able to interact with him directly. So you're getting to the top level of people to kind of voice your concerns, and then, you know, we're all happy to work towards a resolution on these areas, or if not a resolution, at least to mediate some of the concerns.
And I would agree, and you'll see me at these meetings as well, and looking and learning and hearing what people have to say. We're always going to be learning, and I think that's what's nice about it. This is a living community, and it's a living, you know, any of our policies are living, it's a living policy, it's living documents, and things are going to be changing. We always have to be prepared for some of that, and then it's exciting to have some of those things going. You know, being here only week 3, back in Somerville only in week 3, it's been an exciting opportunity to be here, and I'm looking forward to meeting more and more of the community. In my new role here, really being out there and seeing who my partners are, seeing who the partnerships are that maybe haven't been explored as of yet, and where we can bring people together and really making sure that we look at an overall total picture for a healthy community. And I'm excited to do the work. I'm excited to be here, and I'm looking forward to being a community member. I'm living in Somerville itself, living in the Winter Hill area, so I get to walk to work every day and be part of it. And it's going to be a great opportunity for all of us. And I look forward to working with you and working with everybody else within the community, working with the mayor on a variety of initiatives, and the entire staff. Health and Human Services really will stretch over almost every single department. We'll touch every department in a different capacity, whether that's working with traffic and parking about livability issues and making sure that they're working with ISD on housing issues or even the restaurant inspections, which are still under the Board of Health, but they're just being done by people over at the inspectional services area. Working with our housing division to really look at affordable housing and what does that mean, and how do we have access to decent affordable housing. It's not just affordable housing, it's got to be decent affordable housing, and what does that mean, and really define what we're talking about, a lot of those things. Again, it's building a community and really making sure that we have those supports that are available to make this a great place to live, work, play, and raise a family.
Excellent. Thank you so much for taking the time to come on today. Like I said, I feel there are so many more areas we can delve into, and perhaps in the future we'll do a 6-month update to see what new initiatives are happening. But I appreciate you taking the time to come on, introduce yourself, and if the community members have questions, they know how to reach you. It's right through the main city number. So.
That's correct. And I look forward to hearing from everybody, and thank you for this opportunity.
Excellent. As always, I'd like to thank the production crew, Joe Constantine, Steve DiCarlo, and George Wood. Thanks for watching. We'll see you next month.